Come in.
Hi, I'm Kagan. I'm going to be your nurse today. Can you state your name and date of birth for me?
Peggy Smith, 7777.
Okay. I'm going to be inspecting your neck, your jugular vein, your heart, and your pulses, if that's okay.
That's fine.
Okay. I'm going to pull the curtain for privacy, and I'm going to wash my hands. Okay, so first we're going to inspect your neck vessels. The cline is supine 30 to 45 degrees. I'm at the right of the patient. I'm going to have the client turn the head to the left. And I'm going to inspect. Turn the head to the right. I'm going to inspect. Okay, the venous pulse is not visible. No jugular veins distended. I'm going to raise the head of the bed 45 to 60 degrees, and I'm going to observe the pulse. No distension, protrusion, or bulging. I see. Okay, I'm going to oscillate the carotid with the bell of my stethoscope. Okay, I'm going to have you hold your breath. Okay. Now hold your breath again. No bruise noted, no swishing or blowing sounds. Okay, now I'm going to palpate the carotid with my index and my middle finger, not together at the same time. Pulses are strong, 2+ on that side. Pulses are strong, 2+. No variation in strength. The arteries are elastic, no thrills noted. Okay, I'm going to inspect pulsations on the anterior chest wall over the heart. My cline is supine, 30 to 45 degrees. And I'm going to inspect now. Okay. No visible pulses that I can see. Okay, I'm going to palpate the apical pulse, 1 to 2 fingers, the mitral area, 5th intercostal. If you can feel it, have the client roll to the left side if you cannot feel it. And in large breasts or obese people, it may not be palpable. Okay, I'm going to palpate the epitrochlear lymph nodes. I'm going to have my patient flex the elbow 90 degrees, and I'm going to palpate behind in the groove of the bicep, between the bicep and the tricep. The epitrochlear nodes are not palpable. Okay, now I'm going to perform the Allen's test. With my patient's hand rests on the table, I'm going to occlude the radial and ulnar arteries and release at the same time and see that the color turns back to pink within 3 to 5 seconds. And it did. Oh, I'm going to do it on the other one also. Okay, we're good. Okay, now I'm going to have my patient supine. I'm going to inspect the legs. I'm going to drape the growing area. I'm going to put a pillow underneath my patient's head. I'm going to inspect the legs for any lesions, alterations. Skin legs are swollen or shaven. No atrophy. They're the same shape and size bilaterally. They look good. No edema noted. Okay, I'm going to palpate the legs bilaterally for temp, using the back of my fingers to see if they are equally warm, and they are equally warm bilaterally. I'm going to palpate the superficial inguinal lymph nodes of the upper thigh. No tender movable lymph nodes are noted, up to 1 to 2 centimeters. I'm going to palpate the popliteal pulses. The client raises the knee partially. I'm going to use my thumb and fingers on the knees and their amplitude bilaterally. I'm going to palpate the dorsal pedal pulses on the foot. Okay. I'm going to apply light pressure. The pulses are bilaterally strong. Okay, I'm going to palpate the posterior tibial pulses between the ankle and the Achilles, and they are strong bilaterally. I'm going to inspect for varicose veins, thrombophlebitis. I'm going to ask my patient to stand. The veins are flat and unseen. I see no varicose veins and no swelling. Okay, now I'm going to inspect the arms. No, they're the same bilaterally. I see no lesions, no edema, no prominent vein pattern, and they are symmetrical. They don't vary in size or shape. Okay, I'm going to observe coloration of the hands. The skin tone is the same bilaterally. No cyanosis, redness, or swelling. I'm going to palpate the fingers of the hands. The skin is warm to touch bilaterally. The fingertips to upper arms. The capillary refill color returned within 2 seconds or less bilaterally. I'm going to palpate the radial pulses bilaterally. They are on the thumb side of the arm. They are 2+ strong. Artery walls have resistant quality. I'm going to palpate the ulnar pulses, which they are on the pinky side, and they are not detectable because they're deeper. Okay, I'm going to palpate the brachial pulse. This is if I suspect arterial insufficiency or antecubital crease. The brachial pulse both have strength bilaterally. Okay, now I'm going to oscillate the heart rhythm. Okay, so the aortic is going to be second intercostal on the right side. On the right side. I would listen for 1 minute. The pulmonic is going to be on the second intercostal on the left side. The Erb's point is third intercostal on the left. Tricuspid is going to be on the mid-clavicular 5th intercostal. And the mitral is the 5th intercostal mid-clavicular also. They all have regular rhythm. They're 60 to 100 beats per minute is what they would be. And I would make sure I listen to all of them. Oscillating the pulse defect. If it was irregular, I would listen to the rhythm between the radial and the apical at the same time and count for 1 minute. If there's differences, it may indicate AFib, flutters, contractions of the heart, or blockage. I would oscillate for extra heart sounds using the diaphragm first and then the bell of the entire heart area. I hear no clicks, frictions, rubs, no S3 gallops or S4s. And I would oscillate for murmurs. Different positions, left lateral with the bell of the apex, sit up, lean forward, examples, or supine. I would listen for all those. S1 and S2 would be heard and no murmurs. And that's it.